In this video, we'll explore how to adjust the dose when you get an abnormal pharmacogenetic gene. When you get an abnormal result for a pharmacokinetic gene, most genetic tests advise you to avoid medications that are metabolized by that enzyme. But what if you need to use that med? Here's how to adjust the dose based on the gene. For poor metabolizers, here we're going to worry about side effects as the dose goes too high, so start low and go slow. Start at half the usual dose and raise it twice as slowly as you normally would. Lower the target dose by about 30 to 70%. For rapid metabolizers, it's efficacy that we worry about, or a lack of efficacy as the serum level goes too low. Here you can titrate faster, but you should slow down if side effects occur. The key thing, though, is to aim for a higher target dose with rapid metabolizers, about 135 to 180% higher. Those numbers are just rough estimates. Many other factors besides pharmacogenetics influence drug effects, so the more important rule here is to dose based on your patient's response. And if you're in doubt and need some more confirmation, you can check a serum level of most psychiatric medications. Let's summarize the key points for this talk. Some patients respond well to medications that are metabolized through pathways that are altered by their genetics. Rather than avoiding these medications entirely, you can adjust the dose based on the way that they metabolize it. For poor metabolizers, you can avoid side effects by starting slow and aiming for a lower target dose, reducing it by 30 to 70%. For ultra-rapid metabolizers, you can achieve better efficacy by aiming for a higher target dose, raising it by 135 to 180%.